I want to bring in Dr. Bruce Aylward now. He's Senior Advisor to the Director General at the WHO. He joins me from Geneva. Doctor, good morning. Perfect timing to have you with us. As we see this vaccine being rolled out now here in Canada, what are your thoughts on how big of a game changer this is in the fight against coronavirus?
Solution. This is the light at the end of a very long tunnel. The light's getting brighter, definitely, but the tunnel is still long, that's for sure. But this is a really important part of the way forward. But as you know, there in Canada, right, this is a very scarce product, still very limited number of doses. So we still have to do everything else. But knowing that this vaccine is there, knowing that it's going to be rolled out, I think just makes it easier for everybody now to accept the other measures and do everything they can to control this disease.
And you say it's going to be a long, dark tunnel, and certainly we get that. This is really just the first step in a long journey. What's the WHO's view on how long we're going to be dealing with the pandemic now that the vaccines are starting to go into people's arms?
Yeah, I think the easiest way to think about that is to look at the epidemic curve, right? If you look at that pandemic curve from the last 7-8 months, it's been going up, 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 up. It's not going to drop and stop completely and suddenly. It's going to take time for this to come down, even when we have effective tools in an epidemic, pandemics for other diseases. What you see is a curbing of that curve and then a slow decline and a skewing of it. So we're still going to be dealing with this disease well into 2021. We're still going to need to be taking some precautions, definitely, even when we get the population substantially vaccinated. But what we're hoping, right, is that as we go into the next flu season, we fundamentally change the dynamic of this disease.
And of course, you take a global perspective. How concerned are you that countries that don't have the wealth that others do will get that vaccine in due time?
Well, this is what the project that I'm running is all about, what we call the ACT Accelerator. And Canada is a very big part of this. It stands for the Access to COVID Tools Accelerator. And this whole initiative has been established to make sure that as many countries as possible around the world, irrespective of their wealth, get access to these products as rapidly as possible. So our goal is that in very early 2021, we are rolling these products out to countries in low-income settings, low middle-income settings, as well as the high-income settings where you're seeing them today. But we want that gap to be very, very short. And thanks to countries like Canada, we think it will be a very, very short window between the two.
Doctor, there's news this morning about a new strain of the coronavirus in southern England. Does that mean that the virus is mutating? And what will that mean about the efficacy of the new vaccines?
Well, it's a great question, but this actually isn't the first strain that we would have seen emerging. As you have seen in news coverage of this over the past months, in different parts of the world at different times, different strains have been the predominant one that have been seen predominantly, and there may be various reasons for that. So far, we have not seen any evidence that the evolution and the change and the mutations in the virus have changed the fundamentals that allow the vaccines and immunity to work against it. But that's a really important piece of the science that needs to continue and the research. We've only known this disease now still for less than a year. We're still learning about it, and it would be really inappropriate to say we know the answers to those questions. So we're looking at it, we're watching it, and very, very intently studying it, but there is no evidence yet that it changed the fundamentals about how efficacious these vaccines will be, because the part of the virus that these vaccines are targeting is relatively stable. So we're for the moment, this looks to be manageable.
And final question for you, Doctor. As you rightly point out, this vaccine has been on our radar, or excuse me, this virus has been on our radar for less than a year. And we all remember those first few days and weeks reporting on what was going on in Wuhan. Of course, we were paying close attention to your daily briefings at the WHO. I know you traveled there. Give us your thoughts when you stand back and you think, big picture, here we are, less than a year in, and we've already got a vaccine going into people's arms. People are still skeptical about the science. What are your thoughts?
No, this is an extraordinary situation we're in today, where we've seen, as a result of an simply amazing international collaboration at the political, scientific, technical, operational levels that have allowed the science to move so rapidly and at the same time safely. So what we're seeing is the fruit of decades and decades of work in public health, in science, play out. So it's gratifying. That's the word I would use. It's gratifying to see those investments paying off with the rapid development of these tools, much more equitable thinking in terms of how they get rolled out, and hopefully, as a result, a very different dynamic for this outbreak or pandemic than we otherwise would have seen.
Is a vaccine the only way to get out of this?
No, we've already seen in other parts of the world that through really, let's say, stringent application of case finding, contact tracing, rapid isolation, that people have been able to get their numbers down to very, very low numbers in some countries, in some areas, and be able to manage, reopen their economies safely. So, vaccine is certainly important. It's super important to being able to do this more easily. And in the long term, this is the right answer, but do we still have tools and knowledge that could have made a much bigger dent in this disease, and that we have to continue applying in the coming months as we get vaccination coverage up there?
From Geneva, Dr. Bruce Aylward, Senior Advisor to the Director General at the WHO. Doctor, thank you so much.
My pleasure.